Hello, hope you're keeping well. Today's video, we're going to be looking at section 4 of the health equity assessment. We're going to be looking at the causes of inequalities. In the last video, we were looking at distribution of health. If you've not seen that, then obviously you want to flip back to that one, back onto the channel. So when we're looking at the cause of inequalities, we're asking ourselves a number of questions here. And there's probably 4 key lines of inquiry that we can ask ourselves. Firstly, around which wider determinants are influential here. So what are the actual drivers behind that? Is it things like wider determinants of health and well-being? So is it things around income, how much money people have got in their back pocket? Is it things around education, local employment? Is there anything around housing or community, or even things like racism and discrimination? So when we're talking about the causes of inequalities, a lot of these things are around the wider determinants of health and well-being, and that's what's going to help frame the problem even more, and help take into account what those wider determinants of health and well-being are. So whatever improvement you want to make, whatever problem you wish to solve, obviously the healthcare setting we're talking about here, but whatever it is, by taking into account those wider determinants of health and well-being, you're actually framing how you're going to address that, taking into account those wider determinants. And hopefully what that means is you come up with a better solution that's going to work for the people you're trying to help out. So the second bit around the cause of inequalities is asking yourself a question around, is there anything here, any aspects around people's mental health and well-being that are at play here as well? And what are the kind of risks that are at play? So depending on what it is that you're looking to improve on, in terms of improvement in access, experience and outcomes, mental health and well-being may well play a role. And the important thing about this part of the health equity assessment tool is just trying to figure out how, in what way might that appear. And always remember, if we don't know, then what can we do to try and find out? Just those key lines of inquiry through those coaching conversations again. Thirdly, do health behaviours play a role? And if so, in what way? How does that manifest itself? Health behaviours. And then lastly, we ask ourselves, does service quality, access and take-up increase the chances of health inequalities in your chosen work area? So yeah, does the quality of the service, does there access to it and take-up in what way does it increase the chance of health inequalities happening? So, I mean, a good example, a recent example that we could cite is around access to the COVID vaccine. So certainly access to that increases the chances of health inequalities, because we shone a light on so many inequalities with the COVID vaccine. And that helped us shine a light on other equal things around, or other equal challenges around access to other forms of health improvement and prevention as well. So it's a lot of common themes we learned from the COVID vaccine that we should be taking on board. So, I mean, it pretty much wraps up section 4, causes of inequalities. But actually, I think the other thing to consider here is, in this section, you're thinking about the drivers behind those inequalities. So think about, the local economy, housing, power, discrimination and lifestyle. Those kind of things are at play here. We're going to be coming on, some of those things you would have referred to in the data and evidence section. And some of these things are going to be, some of those smoke signals you're going to point to in the data section in section 2. But to wrap up section 4, I think the key thing about this is about talking about aspects that you can directly control, those causes of inequality. So what things are within our gift that we can directly control? What are the things that we can influence? And what are the things that are really, really out of our control? So the reason why we're asking ourselves those questions in this part of the HEAT tool is that actually there's only going to really be certain things within our gift that we can influence and control. This is an opportunity to kind of state what those things are. It actually helps scope exactly what it is you want to do. It helps refine the problem that you think you're trying to solve, and it really helps you. It helps you to focus on, for the inequalities that you've discovered lurking around. Really, what tangible action can we actually take? Can we actually take to try and start tackling those? And what are the things that really actually we don't have a lot of influence over? So, I mean, typically an example is that we don't have a lot of influence and control over national government policy. Some of us might be able to lobby for change in that respect. Really, within our sphere of influence, we don't. None of us sit in Parliament. Well, no, I don't. But yeah, we can influence moderately, but there's only certain things that we can do. We do have influence over how we invest our budget for things like the Integrated Care Board, or whichever organisation you work for. We do have an influence over that. We can influence how those funds are invested, how we go about making good quality decisions to target resource. So that is within our gift, definitely. It's within our gift to work in partnership effectively with other people across the system to try and pool our resources, to try and tackle inequalities at a system level. So yeah, that's section 4, the cause of inequalities. Give that one a try, see how you get on using the scenario that you have in question. In the next video, we're going to be looking at things like the evaluation criteria, and we're also going to be looking at how you go about refining what it is you want to do, taking into account the things you have learned so far. And then the last video, the last video is going to be about what actual practical actions you're going to take. And there we go. So I'll catch up in the next video. In the meantime, take care. See you. Bye.